I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plan. Our topic today is the Ultimate Mouth Manual. And with me in the studio is Dr. Lee Sheldon, who is really the owner of Solid Bite Dental Implants. Lee, welcome to the show.
Thanks. Good to be here, Joe.
Well, you know, we've done a lot of television work, a lot of radio work, and newspaper work on programs designed to help seniors age with dignity and get them to help develop their own aging and care plan. And it's not just your work as a periodontist and other different resources in the area. I think it's important that I'm really, truly interested in why you wrote the Ultimate Mouth Manual. Well,
it's interesting. By the way, here's the Ultimate Mouth Manual if you want to take a look at it. It is available on Amazon. But the more important part of it was my patients really needed a resource. You know, the fact is that you only know as much about dental care as you choose to know. But as we get older, there are more things to know. There are more things we need to know about prevention to prevent people from coming to my office. But if people do come into my office or to any dental office, they need to know some of the options that are available to them. The fact is that there are things that affect people as they get older. They get tooth decay more often, sometimes, particularly with medications. They have periodontal disease. The latest study says 50% of people in the United States have periodontal disease. They need something to secure their dentures with dental implants, or they may want to have a complete mouth makeover. Well, all of those things are described in the book, and I hope I wrote it in layman's terms so that it can be easily understood.
Well, folks, what I really liked about the book is the simplicity of the sketches about how the tooth goes down into the gum and what happens on the tooth line. And I feel like in all my work with you, Dr. Sheldon, I feel like I've become somewhat of a layman's expert on dental care because, you made a comment about people coming in to see you. And I remember the day that 50 years ago, I was on a submarine. I was a young submarine officer, and I had two reserve dentists on board. And it was in 1960, and these dentists decided I needed to have a couple of teeth extracted. And they told me to come up to the submarine tender on a Saturday morning. And I sat there for 8 hours with a rubber dam in my mouth while I extracted a couple of teeth, put an implant in, and that's been in there for 50 years until I was having some problems with it, and I showed up in your office, and you were standing there with your pink scrubs on, and you said, you finally came to see me.
That's right. You finally made it.
Yeah. What's interesting about the Ultimate Mouth Manual, in my opinion, is that it helps a layperson understand some of the underlying causes of mouth pain, and more importantly, how what happens to your mouth affects other parts of your body.
That's right. You know, we used to have this idea, both in medicine and in dentistry, but particularly in dentistry, that somehow the mouth is separated from the rest of the body. Well, how could that really be? You know, if someone has periodontal disease, which is inflammation of the gum tissues, but more importantly, loss of the bone support for the teeth, if that's going on, that kind of inflammatory problem is going on in the mouth, is it just related to the mouth? Is it just going to happen here? Well, early on, we said yes. Now, it's clear that if we have an inflammatory change here, there are inflammatory changes that could be going on here, or in the lungs, any place, and that there is a commonality between dental disease or periodontal disease and other general diseases of the body.
Especially for seniors.
Yeah, that's right.
I think as we become older, our body's immune system starts to break down.
Sure.
And if something happens, most people are not aware that the gums are one of the greatest conductors of disease.
That's right. I mean, if you take a look under the gums, and of course I have a chance to look at it, but just look at it under the microscope. If we were to picture a blood vessel is enclosed and blood flows through it. But if you take a look at a person who has gum disease, so those blood vessels are open. Literally, there are ulcers on the inside of the gums. And so those ulcers then can gather bacteria, can gather some of the byproducts that occur as a result of the disease, and once it goes in through those ulcers, it is disseminated through the rest of the body. The question then is, what can we do about it? What can we do to help somebody when that does occur?
And that's exactly what is described in this book.
Yeah.
But it's made simple.
Right.
It's very simple. I remember there was in one chapter you talk about cancer. And you say it's very important if somebody is going to have a cancer operation for them to see their dentist before they have any type of surgery. Why?
That's right.
Why is that?
Well, particularly with radiation therapy, but chemotherapy as well. When in the mouth there is a neutral pH, a neutral acid level, about 7.0 if you remember your high school biology. Okay? But that's neutral. That means a glass of water would be 7.0.
Okay.
And the saliva keeps the mouth at that neutral acid base level, so there are no attacks that can occur. When you have radiation therapy applied, in particular, the salivary glands shut down. When the salivary glands shut down, the mouth is dry. A dry mouth is acidic. That means it produces acids. And so a dry mouth will then literally cause the teeth to be eaten away and cause tooth decay later in life, or cause tooth decay as a result of the radiation therapy where you may never have had decay before. And therefore we need to institute certain measures, some preventive measures, in order to help protect you against the onslaught of the acids that could occur in the mouth as a result of the radiation therapy. The same thing occurs in chemotherapy, and even medication therapy. Medications, not just for cancer, but all of the medications that we take now. There are 500 medications that cause dry mouth, and so the same acid problem occurs.
Well, in a greater scheme of things, in this new program we've designed called Helping Seniors of Brevard County, we're very avid believers in the radio, the television, and the newspaper outlets for making our points known to people that are unsuspecting of all these things that can affect them. So in the course of doing what we're talking about today, we're going to do a show on over-medicating.
Yep.
We're going to do a show on senior dental care. We're going to do a show on what are called the
We're going to do one on dental implants.
Dental implants.
We're going to do one on periodontal disease. We're going to do one on headaches and how headaches are related to what goes on in the mouth.
Yeah.
And we'll cover a lot of other things too.
And when we decided that we would do the show on headaches, I said to you, what on earth does a dentist have to do with headaches? And I read the chapter in the Ultimate Mouth Manual, and I became aware of things that I personally needed to do. And one of them was after talking to you and my dentist, Dr. Mason, I needed to get a mouth guard made for my upper teeth so that I didn't grind my teeth at night.
Sure.
And that's another thing that's discussed in this manual. What's significant about that?
The significance of grinding the teeth, there are a couple of significances. One is you don't want to grind your teeth away. It's much easier to grind a piece of plastic which can be replaced, like that mouth guard you're talking about, than to grind your teeth. It's a lot more expensive to replace your teeth than it is to replace a piece of plastic. So that's one practical value. But the other thing is, when you grind your teeth, there are muscles. There are muscles that are working very, very hard. You actually have your mouth like this, and these muscles are activated. These muscles are innervated by the same nerve that causes headaches. So if this nerve is hyperactive, you can imagine what's happening to the sensory nerve, the one that allows us to feel what's going on. That becomes hyperactive. And people get headaches, and they don't understand where the headaches are coming from.
And that's why you get a pain in here and over here in your jaw and these muscles.
Oh, yeah, you'll get a pain here, but you also get a pain here. You'll get a pain here. You'll get a pain in the back of your neck. You may even get a pain in your shoulders, all as a result of this grinding. And what happens is when you put a piece of plastic between the teeth, for some reason, these muscles relax. And when that occurs, people feel a lot better.
Okay, I wear that brace at night.
Yep.
And when I get up in the morning, and I can feel myself. I read a book at night before I go to sleep, and I feel my teeth against that. It's soft. Then the next morning, when I take that denture thing out, it feels like my jaw is offset, and it takes a while. My teeth don't mesh the right way, and it takes about 15 or 20 minutes for everything to go back to normal.
That's right. And that's a common finding. The fact is that the jaws want to meet one way, but the teeth are guiding it into a different position. And just because your teeth are meeting the correct way doesn't necessarily mean your jaws want to be there. So imagine this. You're wearing a flat piece of plastic on your mouth. Now the lower jaw can go wherever it wants to go. And that's what's going on at night. It's moving into the position that's most natural. Then you take that out, and now the teeth are forcing it into a position that it really doesn't want to go into.
Yeah. When I was having a problem with that bridge that I had, it covered 3 teeth, and I went over to see you that day, and you were standing there in your pink scrubs, and you had sort of a smile on your face, and I said, you were just waiting for me to come back because you knew eventually that I would have to have a dental implant.
That's right.
Because if you have a tooth that comes out in between 2 teeth, you can put a cap on, put a temporary bridge in there, or a permanent bridge. You can do all that.
That's right.
But when you lose teeth in the back and there's no way to anchor it, thank God that some dentists came up with dental implants.
That's right. And what is a dental implant? Most people don't even know what a dental implant is, so let me just describe it. And I know we'll be doing
this is all in the book. That's what we're talking about today.
That's right. But a dental implant is nothing more. Well, let's picture this. You see a tooth. You see the top of the tooth. It's called the crown of the tooth. And then there are the roots underneath. If you had a tooth extracted, you know that the roots need to be extracted. All a dental implant is a new root for the tooth. So essentially, where the old root was, you're putting a new root in. It's made out of titanium, or sometimes it's made out of ceramic material, and it doesn't decay, and it doesn't break. So now you can put structural supports or new roots into the jawbone, and then fasten teeth to them. So you can chew just the way you used to chew when you had your natural teeth.
If we didn't have Novocaine, lidocaine, and stuff like that, and happy gas and all these things, some of the things that dentists do could be extremely painful.
They could. I mean, there was a time when dentistry was first developed. What did we do? We extracted teeth. That's all we did, and then dentures came about.
Yeah.
Certainly things became a lot more sophisticated once we had local anesthetics available. And it isn't just local anesthetics. People actually are sedated and can be sedated in the dental office as well, particularly for those people who have high anxiety and don't want to be in the dental environment, and we can understand that. So there are lots of different options available. But the fact is, if we couldn't get somebody numb, if we couldn't get somebody sedated, we wouldn't be able to do the work that we can do today. And today, we can do everything comfortably, and the end result is very similar to what you had when you did have your teeth, whether you're missing one tooth or whether you're missing all of your teeth.
And folks, what Dr. Sheldon is describing is so honest. While it's in this book, it's in the book, but it's important that you understand that these things, through what Dr. Sheldon's described, have become almost an everyday procedure.
That's right.
For doctors and dentists qualified to do this. And that's another thing that you talk about in your book. You want to go to the right person. You want to go to somebody that knows what they're doing. In my case, at my age, my gums have receded some, and when you extracted the 2 teeth that had to come out, I had cracked both teeth, and there was absolutely no way to save them, folks. And Dr. Sheldon pointed this out through x-rays. He showed me where the gum disease was and where the parts around my teeth were bad. And he took those teeth out, and he mixed some of my blood with another product they have, put it down into the gums to help grow the bone.
Right.
I'm doing the layperson part. He'll talk about the other part of it. But I think if you understand what I felt and what I understood, it's easier to understand this process and the importance of it. Because what he did was he put this stuff down in my gum, and my bone grew so much that when you went to put the implants in order to have the proper spacing between the new bridge, which I still haven't got, which I'm going to get, that he had to shave bone down.
That's right. You're a good bone grower.
Well, I did. But what the important was, I didn't feel a thing beyond the first little prick of that needle going into my gum to deaden it. That's the way you did the shots. It's like selecting an orthodontist, a periodontist, a lawyer. If you want to get involved in the legal aspects of aging and develop trusts and how you protect your money as you get older, you're not going to go to an attorney that sells real estate. Right. You want to go to somebody that knows what they're doing. Right. And with your experience as a periodontist, you have described in your book a very simplistic approach for the layperson understanding the significance of periodontal disease and how many corrections have been made.
And that's the point. I want this to be a simple manual. What we do in our office is anything but simple. In order to be able to do the things that we need to do, we need equipment and we need a well-trained staff. These days for dental implants, I can't conceive of even placing a dental implant without the CT scan that you had done. Because I'm placing an implant in a...
Say that again, because we talk about MRIs and CT scans of the body and everything, but you have a machine in your office that does a CT scan of the jaw.
That's right.
And I sat there and looked at all this stuff. So I'm very much aware of what Dr. Sheldon's talking about.
Well, I'm operating in a three-dimensional world. I'm operating on your jaw. I need to know the irregularities in your jaw, so I'm drilling in the right place, if we want to use, layman's language, drilling. And the fact is that if I have a conventional x-ray, I can't see that. But if I have a three-dimensional x-ray called a CT scan, I can look at your bone from every angle and know the ideal position for the dental implant.
But it's important to have the right kind of equipment to do delicate work.
Sure.
And when you think about drilling down into a jaw, that is delicate.
Yes, it is. And there are certain things that we're looking for when we drill into the jaw. We're looking at how high the bone is, how wide the bone is. And I can measure all of that on the CT scan. How dense the bone is. Some people have denser bone than others, and they're treated differently. How much room there is between the teeth and where the implant is. Whether the teeth have dropped down, preventing me from placing a tooth in that spot. All of that needs to be known in advance. And not only do we have the CT scan, but we have treatment planning software, which allows me to do virtual surgery on your mouth before I ever do it in your mouth. All of these things are really important to make sure that we get the best result possible.
Yeah. And while we're hitting so many different aspects of dentistry, Dr. Sheldon, but in your book, what are some of the other things that you really think are important that people need to understand? I've got a list of questions here, but, one of them is a question I have here. It says, what should seniors be attentive to regarding mouth care?
Okay.
What do you describe about that in the book?
Well, the first thing we need to realize about mouth care is your mouth isn't the same now as it was when you were 20 years old, or 15 years old, or even when you were 40 years old. The fact
I know that.
Okay. And the fact is that things occur as part of life and as part of aging. Sometimes the gums recede. In fact, very often they do. So the root that used to be under the gum is now exposed to the outside. Okay. The root itself isn't mineralized as much as the enamel is. In other words, the root is softer, so that it is more prone to certain diseases. So that if you have the problem we talked about at the beginning of the show, if we talk about the problem of acids will eat away at the root more readily than they'll eat away at the enamel of the tooth. So that if you're on medications and your mouth is dry, it's important as soon as you recognize that your mouth is dry, or let's take it even earlier than that. Once you're on those medications which cause dry mouth, and as I said, there are 500 medications that cause dry mouth, You ought to look at something that you can do to moisturize your mouth. Baking soda rinses, for example, will moisturize your mouth. And will neutralize the acid levels in the mouth. And there are products that are available at the drugstore which will moisten the mouth and keep the mouth moist for an extended period of time. So that's one side of it. The other side is the periodontal disease part of it. You take that probe, you put that probe down below the gum line.
I know.
And it doesn't have to hurt. I see you cringing. It doesn't have to hurt. But when you probe, you're looking at how many millimeters that probe goes down below the gum line before it reaches some attachment. The good numbers are number 1, 2, and 3. 1 millimeter, 2 millimeters, and 3 millimeters below the gum line, that's the normal gum height. But once it goes farther than that, there's usually a disease entity working. And if that's the case, we need to identify that disease early. This is one of those diseases where if you identify the disease early and you treat it early, you get to keep the tooth. And so it's important that examination be done at least once a year to make sure that you don't have disease. And if you do have disease, to get it treated and get it treated effectively. And in the book, I even talk about effective non-surgical treatment. We have a little endoscope, a tiny camera that goes below the gum line, so we can see the bacterial accretions on the tooth and be able to get the roots clean, because that's what's happening when you have periodontal disease. You have dirty roots that have bacteria on them. If you can see those roots, and you can clean those roots by looking at where those bacterial deposits are, you have a much better chance of controlling that periodontal disease without ever needing gum surgery.
Yeah. Several months ago, I was flossing my teeth, and I was getting the front lower, and I felt something with my tongue. Felt like I chipped away my tooth. And I kept using this dental floss, and that I thought the chipping was getting larger, so I called you. And you laughed, and you said, that's plaque.
That's right.
And as much as I flossed my teeth, I had never really thought about breaking away that plaque myself. And that's exactly the purpose of flossing.
Yeah, that's the particular area in the lower front teeth. You have salivary ducts that come out of that area. Saliva is actually bathing the inside of the tooth. And the saliva carries calcium deposits with it. And so it calcifies on that tooth surface, and so you floss it, and that calcification comes loose. It's called calculus or tartar. It's something that usually is cleaned off by the dental hygienist. But yeah, if we floss our teeth properly every day, we can make the dental hygiene experience a lot easier.
When we brush our teeth, we're brushing the outside and the top, or the inside.
Right.
But there's a whole nother area between each teeth.
That's right.
That if you don't floss, you're not reaching that part of your tooth.
60% of the tooth surface is between the teeth. A brush isn't going to go there. And so when we talk about using floss, I know we nag about floss and we nag about cleaning between the teeth, but if 60% of the tooth is an area that's inaccessible to the brush, what do? Ignore it? Or clean between the teeth. And of course, that's important. You want to avoid seeing me. I mean, I love doing the work that I do. I do. But the nice thing is when we can prevent you from needing the work that I do. And part of that is making sure that we get between the teeth effectively and remove the plaque just once a day.
That's a topic of another show that we'll do on this whole network we're creating of shows to help seniors develop their care plans and aging plans and how they can do a better job of caring for themselves and not be exposed to medical treatment if they can avoid it.
Yeah, it's nice to be able to avoid medical treatment. That's going to be part of these shows. We're going to have some very qualified clinicians who take you from every aspect of aging and through every aspect of aging, who will talk about treatment, but they'll also talk about prevention. We've got a great group who's part of helping Seniors of Brevard County and the Focus on Seniors program.
And when you think about, we'll do 7 or 8 shows on dentistry. We'll have shows on women's heart disease and breast cancer. We'll have shows on men's heart disease and prostate cancer, but we'll cover cardiovascular disease. We'll cover so many things. So we'll now have another show that you and Nancy Deerdorf, who is the administrator for the local offices for Gentiva Healthcare, and we'll do a show on the organization helping seniors of Brevard County as to why the organization exists and what we hope to do there. But it's important that people understand that if you're aware of some of the simpler things you can do, that you can avoid very, very extensive dental treatments.
You can. Do we have a little bit more time?
Sure.
There's one part in the book that we don't talk about very much, but it's really important. There are lots of people in the United States who have sleep apnea, and they have this mask that goes over the nose or goes over the mouth in order to push air in order to open up the throat so you're breathing. What's sleep apnea? You stop breathing at night.
Right.
Well, about 50% of the people who use, it's called CPAP, by the way, and that's the name of the mask that's put over the mouth and over the nose. The CPAP device works every time, but only 50% of the people who have it prescribed can wear it. Do you know what the second approach is, as recommended by the American Academy of Sleep Medicine?
No. What?
It's an appliance. It's a dental appliance that goes in the mouth, an oral appliance, which brings the jaw forward. If you've ever taken CPR, you know when you're opening the airway, what do? You bring the jaw forward in order to open the airway, in order to help somebody breathe.
Okay.
So this is an appliance that's placed in the mouth to bring your jaw forward. When your jaw is forward, your airway opens. And so for those people who can't wear CPAP, there is an oral alternative called the mandibular advancement splint. Mandibular meaning the lower jaw, advancement meaning advancement, and splint is like the night guard that you were talking about, but it's made in its specific way in order to open the airway. It needs to be fully adjustable because we need to get to that sweet spot. And that sweet spot is done by gradually advancing the lower jaw with this appliance until we get to the point where the sleep apnea is gone. We work with pulmonary specialists all the time to help people who can't wear CPAP.
I can't remember. Is that in the book?
That's in the book.
Do you remember how many chapters are in the book?
No. Do you?
No.
I think you've read it more than I have.
He's telling the truth, folks. He wrote the book, but I have read it more than the author has. I really have. And one of the reasons, Dr. Sheldon, is that I read the book so often is I'm an avid reader. I love to read romantic and historical fiction. I really do. My wife says, why do you read all that stuff all the time? But so much of it is based on actual fact. But I've enjoyed reading the Ultimate Mouth Manual, and it's not a promotion just to sell this book, but it's something that's very important. And
it was fun to write.
Yeah.
And by the way, my son contributed to the book as well, so that was even more fun to be able to write one with him.
But we're out of time, and I want to thank you, Dr. Sheldon, for being with the show. We'll be on more shows. Thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 1300 at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. Thank you for watching the show.